Hello, my name is Christopher Mancha, and I will be presenting my teaching plan on otitis externa. We're going to go ahead and start off by introducing otitis externa. Otitis externa is a common infection of the ear that, if left untreated, may cause a life-threatening condition. Otitis externa is defined as inflammation, often accompanied by infection of the external auditory canal. We're going to have several learner outcomes in this presentation. We will first be reviewing a clinical case study. We will review the epidemiology or the rate of occurrence. We will be reviewing the etiology or the cause. We will be reviewing the disease process of otitis externa. We will be reviewing risk factors associated with otitis externa. We will be reviewing the disease process of otitis externa. We will review the signs and symptoms of otitis externa. And finally, we will be reviewing the proper administration of medication for otitis externa. Starting off with the case study review, Jay is a 17-year-old male who is on his high school swim team. He presents with a sudden onset of right ear pain that worsens at night. He says the pain intensifies as he touches his ear and has a feeling of fullness in the ear. On examination, the auditory canal is red and swollen with yellow crusting. The temperature is 98.7 and his tympanic membranes are pearly with landmarks intact. The rate of occurrence is not exactly known. However, we do know that otitis externa occurs more in adults than in children. Etiology: there are normal pathogens part of the normal external auditory canal flora. Risk factors. Risk factors can be broken down into two groups. The first group is environmental. Environmental risk factors are moisture, heat, and humidity in the ear. Host factors are associated with trauma to the external auditory canal. Trauma can be in the form of digital trauma or trauma from a foreign object in the ear. As a side note, earwax is acidic in nature. The acidity helps prohibit bacterial growth. So if we keep our ear too clean, we are taking away the acidity in our ear, which can create an environment for bacteria to grow. On the same token, if we keep our ear too dirty and have an overbuildup of earwax, this can create an environment for moisture to be retained and create an ideal environment for bacteria to grow. The disease process. So we have an environmental or host factor occur. This environmental host factor is going to go ahead and breach the integrity of the external auditory canal. Once the external auditory canal has been breached, there's going to be inflammation and swelling that occur that will lead to pruritus and obstruction of internal structures in the ear. Pruritus is going to lead to scratching, which is going to go ahead and further the trauma to the external auditory canal. Finally, the external auditory canal becomes warm. The pH has changed. We have a moist environment, and it is ideal for bacteria to grow. If otitis externa is not treated, it can go ahead and spread to the bone, which can cause a life-threatening condition. Signs and symptoms of otitis externa. We have a generalized ear pain, pain with manipulation of any part of the ear, fullness in our ear, decreased hearing, itching. At times there can be a discharge from clear to dark yellow. The ear canal, when observed by a clinician, is swollen and narrow. The tympanic membrane may be difficult to visualize due to the swelling in the ear. Treatment. Once you have gone to your doctor and you have been prescribed medications in the form of ear drops, you're going to need to know some simple steps to go ahead and properly administer this medication. Step 1, you're going to go ahead and wash your hand. And step 2, you're going to go ahead and position the ear that you are treating to face upward. You can do this several ways. You can either do this by tilting the head so that the ear you are treating is facing up, or you can have the individual lie down flat with the head turned. For children, you're going to go ahead and gently pull the earlobe down and outward For adults, it's going to be the opposite. It's going to be up and outward. From there, you can go ahead and administer the drops into the ear canal. You're going to go ahead and keep the individual who's being treated in this position for several minutes. That way the drops can go ahead and enter the ear. Going back to the case study, we're going to go ahead and review a couple items in the case study. We see that this individual is on the swim team, which could lead to the idea that there has been a buildup of moisture in the ear. Remember, moisture in the ear can create an ideal environment for pathogens to grow. We see he has signs and symptoms of right ear pain that worsens at nights, and it intensifies when he is touching his ear. He also has a feeling of fullness in his ear. Those are all signs and symptoms involved in otitis externa. On examination for the clinician, it's red and swollen with yellow crusting. Luckily, there's no fever, and we are able to see the tympanic membrane. This concludes my presentation on otitis externa.